So, Richard Kwan is a licensed traditional TCM practitioner, acupuncturist, and owner of Simple Cure's integrative medicine clinic. With 19 years of experience, Richard utilizes an integrative approach combining TCM, Japanese acupuncture, five element theory, and tongue and tan styles, specializing in treating mental and emotional disorders. In addition to his clinic, Richard is a senior advisor at the Acupuncture and Integrative Medicine Academy, AIM, and an instructor at both AIM Academy and the Ontario College of Traditional Chinese Medicine. He's passionate about empowering patients through education and simple lifestyle changes to support their long-term health. With over 25 years of experience in Tai Chi and Qigong, Richard brings a unique intuition and awareness to his practice, helping patients feel truly seen, understood, and cared for. Welcome, Richard.
Thank you. Thank you, everyone. I'm really excited to be here with all of you. I see a lot of familiar names, and I appreciate your presence. One of the reasons why I decided to speak about concussion is there are aspects of concussions that often gets overlooked. And I just wanted to take this opportunity to share some of my experience about concussion, especially since I have had past concussions in the past, multiple ones, though they're not major or severe. But I remember one of my first concussions when I was 5 years old, and I was a child, and I was on a bunk bed, and I jumped off the bunk bed and landed on another bed that was beside the bunk bed, and then bounced into a table and hit my head. I had some stitches, I was bleeding. And ever since then, I noticed that I've been having nausea whenever I was in the car. And I thought it was because my dad was a bad driver. But thinking back, it's actually possible that since then, there may have been some symptoms that I've had that I wasn't aware of that might have been from those concussions. My second concussion was when I had went camping one time, and I had a bike rack at the back of the car, and I opened the trunk, and when I closed the door of the trunk, it slammed down, but I didn't realize there was a bike rack on it. And so the right hit directly on top of my head, and it brought on symptoms of headache, dizziness, disorientation. Luckily, I was about to go on a camping trip. And so during that trip, I spent a lot of time recovering, breathing, resting, and it didn't take too long for me to recover. And so, and for some of you who don't know, I'm also an avid snowboarder. And so, of course, as a snowboarder, when you spend time in the park or jumps, accidents tend to happen, or you might hit a tree because, when you snowboard in glazes and tree areas, when you first start, you definitely will learn the hard way. And so I think that through all my years of injuries, I've actually learned a lot. And through my years, almost 20 years of practice, I've also seen a lot of concussion cases. I remember when I first started, I didn't have a lot of idea or clue around what I needed to do to support a patient who had concussion. And so a lot of my training was just learning from my patients, learning about patients who had headaches and dizziness and a list of different concussion symptoms. And over time, I started diving in deeper into the psycho-emotional aspect of how it impacts a person when a person has concussion. And I think that's the part where I often find more interesting, because when we look at concussion on the surface, it seems like a brain injury or a brain trauma. But at a deeper level, when you go through concussion, it's actually an injury to the consciousness or the Shen at the psychic level. To some degree, your Shen becomes disturbed through the impact or the trauma that is that happens to the head or the brain. And as most of you know, the brain is the sea of marrows, and marrows is connected to our essence and is held by the kidney, and the essence are often the blueprints or holds our deep beliefs and values. And so whenever we go through a trauma or a concussion, it impacts at a deep level to our beliefs, our values, and even our sense of safety and security. And so whenever we go through any level of concussion, trauma, or invasion, I would call it, it happens so quickly, and it happens in such a way that we have no time to process, or we might have no time to react in those moments. And oftentimes when working with trauma or concussions, I would say that often you would go through different phases of process to recovery. And so for some people, they would recover sooner, and for others, it may take way longer to recover. And when it becomes chronic, it becomes post-concussion syndrome. And so today, I want to really dive in a little bit deeper in looking at a case that I've seen in the past 3 months. And she came to me with multiple concussions, multiple major concussions, followed by multiple minor concussions, with a list of also mental emotional conditions, including bipolar 2. And so when working with a patient that is not just coming to you on the physical level, but more on a psycho-emotional level, how do we become more conscious or aware of our practice? And if there's nothing that you remember in today's webinar, I would say awareness is the essence of healing often, because awareness is the activation or the cultivation of Shen. And so as practitioner, the more that we become aware, the more we become conscious, the more activated our Shen becomes, and the better that we're at in helping the patient who's also gone through a Shen disturbance or a trauma to their Shen to come back into their body. Because concussion often causes a split or a separation between the mind and body. It creates often not only trauma, but it also impacts how one functions in the world and how one finds their alignment within themselves. And in the process of healing, if that alignment is not brought into awareness, or when as practitioner, we are putting upon our own agenda, or we're forcing the patient to do things that they're not ready to do, it might even cause re-traumatization or more stagnancies to the patient's condition. And so today, I really want to talk about some key aspects that I've discovered through my 2 decades of practice, and also working with many concussion patients. And even recently, so more so that I've noticed that I think that this is something that will benefit hopefully all of you, because as practitioners, I think that one of the most important aspects is that we continue to grow and to improve ourselves and to bring more awareness to how we practice. Because when we have more awareness, we can practice ethically and we can practice consciously, so that we can be more responsible, not only to the patient, but also to ourselves. And so today, I would love to jump in to a part of the presentation. some of you may or may not know, but most people that encounter concussion typically can heal within a week or two, even without external support. I remember when I had my concussion, a big part of my practice was connecting with myself. And it sounds really simple, but it's something that we often take for granted. And as practitioner, one of the things that we often do is helping our clients to connect with themselves, because most clients don't have a good relationship with their body or themselves, or knowing what their body feels or needs. And so oftentimes when we're practicing to become more aware, awareness is a way to get to know the self. I would say that one of the reasons why I healed and recovered so quickly is my practice of Tai Chi and Qigong for over 25 years. Practicing Tai Chi and Qigong is not only a meditative practice, but it is a practice of getting to be with oneself and to feel and experience oneself in the place of stillness and in the place where your body responds in different environments. And I think that with awareness, the practice of knowing myself and what I need, those are some of the basic essential aspects in healing and recovering. Most people have trouble recovering or healing is because they often come from a place of unrealistic expectations, or not knowing what their body needs, or maybe sometimes even listening to an authority figure giving suggestions that maybe may not be ready for. And so oftentimes the word that I would use is attunement, to help the patient to have attunement to themselves. Because often patients will come to us and they will ask, what do I need to do? Can you give me some exercises, some protocols? And of course, as practitioner, we can give them certain suggestions. And at the same time, the needs that they have may change from day to day. And so I would say that one of the most helpful advice that I've given to a lot of my clients that they've told me is to check the next day how you feel. And so whenever you do something, the impact often isn't immediate, right? When a person has concussion, when a person has, even for a person who've gone through a car accident, in that moment, they don't feel the full impact of the shock. They might even go into denial and say they're fine, right? They might want to be fine because, and everything might seem fine in the moment when your body's goes into fight and flight mode and the adrenals are running and your body is prepared and activated. And so usually most patients feel the symptoms the day after. And so oftentimes I would suggest my clients to really check in with themselves the day after, whether they have went beyond their limit or capacity. And so one of the things that I often talk to clients about is their limit and capacity, because every person's limit and capacity is very different. And even within yourself, your mind might tell you or convince yourself that you have big limit or big capacity, while your body is actually telling you that you have limited capacity or that you're exhausted. And so one of the things that I often help my clients to pay attention to is their capacity in energy and their capacity the next day. Because if they feel wiped out for the whole day next day, that means that they push themselves beyond their capacity. And so oftentimes patients who also have a regular exercise routine, or they're usually physically healthy, they can recover very quickly because of their blood circulation. And so typically, usually people who are more sedentary or they have less awareness of their bodies, often they take much longer to recover. For patients who have repeated concussions or mental emotional health, in particular to anxiety, patients do have a higher tendency of post-concussion syndrome. The reason being is that patients who have high anxiety oftentimes already have difficulty connecting with their bodies. They have difficulty in their circulation. Patients who have high anxiety often has a lot of stagnation, in particular in their chest or in the abdomen. And patients do need to get a lot of support in helping them to be aware or having management tools to manage their anxiety. Of course, acupuncture can be a very good tool in resolving anxiety as well. And so oftentimes we're not just treating the concussion, we're treating also fear and anxiety. And it could be not just concussions, it could be a patient who slipped and fell and they're in pain. And often patients don't know what they need to do when they're in pain. And so in Chinese medicine, we are definitely not averse to pain. We are definitely in the field where we're leaning into pain because pain will bring about healing. When we avoid pain, we actually create compensation and new pain. And so when we lean into conflict, we can resolve it. When we avoid conflict, the conflict keeps coming up and there lies a lot more complex cases. And so as practitioner, we want to bring awareness and bring attention to areas that your patient is either avoiding or not having awareness, or even in denial of, that they are actually not okay. And so sometimes helping the client to really identify the problem is really important. And as difficult or as uncomfortable it is, the sooner that the patients identify what the issue is or where the problem is, the more quickly that the chi can go to that area and resolve it. And so I would say with concussions, even just inquiring where they are hurting or where they're feeling or what they're feeling is an important aspect. And so when we just talk about the physical and we miss the emotional, patients will find it really hard to get better. And so often we are left confused or why our treatments are not working. And so we really want to look at aspects that get affected, where when you look at these common symptoms, for example, on the physical level, headache, fatigue, dizziness is one of the top symptoms that often get reported, right? And so headache being at 75%. And so when we look at on the emotional aspect, for example, mood changes, we're at 50%, but actually these the emotional aspect, if it's left unaddressed, it can actually create further or prolonged concussion symptoms. Because as most of you know, the stagnation of emotions often creates a stagnation or a manifestation of pain in the body. And so when these emotions are not acknowledged or addressed or even looked at, they often are what silently is impacting the patient, right? The patient is afraid to make quick movements when they have concussion, or they're afraid to even move. And so oftentimes fear creates a holding of one's breath, or anxiety often creates holding of one's breath, creating stagnation in the chest. And so when the anxiety is high, the breathing is low. When the breathing is high, the anxiety is low. The more you're in your breath, the more present you are. The less you're breathing, the more your mind goes into the future or in the past. And so one of the primary recovery tools that I often work on with clients is with patients is breath work, or being able to focus on breathing, or being able to help them to breathe deeper. And later on, I'll give you some examples of how that can be done with acupuncture. And it's very simple. 1 or 2 needles often can increase patients' lung capacity by 50%. And when the patient has 50% more lung capacity, patient has 50% more energy. And what is most important about recovery is energy. The more that your body can recharge, the better it is. A patient who is going through concussion will notice that their battery goes down very quickly. It's like you charge your phone and it's only maxed at 50%, or you're at 100%, but it goes down very quickly and you run out. And so I have patients that have reported that like they can't be on screens for very long because the screens drain a lot of our eyes, or the energy from our eyes. Liver yin often gets depleted very quickly from stimulation. And so with any kind of fast stimulation or fast movement, that is very yang. The brain has trouble processing or analyzing information that is stimulating. And that's why one of the most common complaints is sensory sensitivity, sensitive in seeing like lights, sensitive to hearing sounds. I've had patients who have concussion that has said like the music is too loud. Even though we're playing quiet music, I have to turn off all sounds for the patient coming in with concussion, dim all lights, and even cover their eyes so that they would have less stimulation. Now, there's a difference between minimizing stimulation and no stimulation, because to recover is to not have no stimulation, right? The way to recover is not to do nothing often, because recovery is more about going slow and paying attention to what's happening, right? When you have anxiety, anxiety is not a bad thing. Fear is not a bad thing. We sometimes need a healthy dose of fear to remind ourselves to slow down and to pay attention. And so often with concussion, patients need to slow down. And that's exactly what the brain is trying to tell us when we have sensitivities or balance issues. When you have this practice of any kind of internal practice, it doesn't even have to be Tai Chi Qigong. You can be very present with your yoga practice, and you will find that you're connecting to your body in a way that is very different, right? Everything, when you slow down, becomes still. In the place of stillness is when you're cultivating yin. Concussion is a yang problem, right? Yang meaning when you get a concussion, you can't do anything fast, you can't do anything too long, and you can't find your balance because thereby there's too much yang, or you can say yang is rising and yin is deficient, or there is a lack of yin support in what we do. And so whenever we look at concussive symptoms, one of the key aspects is also to slow down. And so it could be slowing down your breathing, it could be slowing down your eating, it could be slowing down your walking, and in a way where you're not necessarily trying to control too much, but you're just, I call it moseying. You're just chilling, moseying, taking your time in the world as if there's nothing urgent as much as your recovery. And this is a very difficult thing for a lot of us, myself included, in a fast-paced environment where we have a certain expectation and a certain level of competencies in our lives. And when that gets taken away, often it's quite defeating, frustrating, disappointing. And a lot of patients will find themselves wanting to rush their healing process. And I find that this often creates a delay of recovery. If for some of you who are avid Tai Chi practices, you know that you would have to practice 10 years before you notice, oh, I got some improvement. And then you have to practice another 10 years before you know, oh, there's another improvement. It's a very slow process because you're cultivating yin and there's nowhere to go, there's nothing to do but to enjoy the chi feeling that you have when you're in yourself with yourself. And so, in a way, to recover is to really connect with your body. The other two things that I often find with speeding recovery is the stretching of meridians. And so I would say that posture is an important aspect, but also the stretching of the spine, doing spinal exercises that I would sometimes teach my patients through Qigong practice. I mean, even if you do yoga, doing cat cow, or just breathing in and out with some movements is really beneficial, right? And it could be not even with movements of the neck. You can do something as simple as breathing in, closing your eyes and like clenching your face, and then breathing out, opening your eyes and mouth and face can be really stimulating for the sensory orifices and being able to connect to the body and reactivating the nerves in your system. And of course, you want to be able to go slow, and in every movement, you go with the breath, right? And so being able to breathe in, breathe out, and simply being able to help your patient to find the method or the type of healing tools that they need. Because some patients who are younger or more athletic, they might recover faster. Others might be, if they have other mental emotional condition, it might take longer. And so when you look at this list, for some of you who are TCM practitioners, you're already noticing or diagnosing automatically. You see spleen, stomach, you see liver, you see dampness. There's definitely a lot of different patterns and diagnosis that we can look at, which are basic and fundamental. But even more important is to really look at the bigger picture in helping them to calm Shen and relax. And so within your session, I would say that if you can have the patient finish the session relaxed and even have slept and woken up again, I would say that that would be your ideal treatment. The points at some point, it does matter, but in another sense, if the patient can feel comfortable and trust the session, I think that that in itself is already quite the accomplishment, given that they've been through a traumatic event. And sometimes acupuncture needles can sometimes also be quite traumatic. And so for some of you, some of the terms that you might want to tell your patients in terms of acupuncture, how it does is reducing neuroinflammation, improving cerebral blood flow, regulating autonomic nervous system. I think regulating autonomic nervous system is a big one these days because especially if you're treating any kind of trauma or neurological conditions, patients definitely want to turn to things that are regulating autonomic nervous system or supporting the vagus nerve. And there's a lot of different new practices that help with autonomic nervous system regulation. I'm an avid sauna guy, and so I often go to saunas. Sometimes even cold plunges or breath work sessions or sound bath. Those are often really good in calming the nervous system and being able to support patients. But those are sometimes a little bit intensive or aggressive for concussion patients. And so I would definitely not suggest those initially for certain patients, depending on where their body is at. But definitely like gentle meditation, breath work is okay. Light walking is good. When we're talking about recovery, most of the time patients are eager to get back to work. And depending on how severe and how much symptoms that they have, oftentimes we would suggest them to rest at home. Sleep is one of the best healing modalities. Even if they start practicing how to nap in the afternoon, the key is really to notice the wave of the energy that their body has, because patients who are not familiar with their body rhythm or cycle will notice that they will start to crash if they overspend their energy. And so it could be as simple as doing house chores for 1 hour. And typically they could do 5 hours of house chore, 1 hour, they crash. Or screen time, they can only do like half an hour screen time. And if they push themselves or they pretend they're okay and they try to push harder, they might even notice more of a crash or more of an exhaustion. And so a lot of the treatment is helping the patient to find a healthy balance or a steady balance of energy throughout their recovery. And so it's not uncommon for me to tell my patients to come like at least 3 to 5 times a week in the first week or two to ensure a speedy recovery, or even a minimal of twice a week, because the sooner that they can feel better, because as you know, with acupuncture, it takes about 2 to 3 days. But sometimes patient will notice that they relapse quicker because they have a hard time adapting to the changes that they're going through, or they need to recover faster. And so sometimes some of the things that your patient does might take them 2 steps back instead of move them 2 steps forward. And so it's not uncommon that the patient is doing something that they're not aware of that might be hurting their bodies. And so education is very important, continuing to ask questions if they are regressing, if they remember what they did, and also to let them know of their capacity. Those are just some very simple ways to continue to educate and support the patients. Before I run out of time, because this is a very short time, typically my lectures are quite long, but you definitely want the patient to stabilize. Now, there's a lot of concussion tests out there, neurological tests, cognitive tests. Some of the tests actually I find re-traumatizes concussion patients because it hurts their brains to even think about questions or remember questions. And some of those tests might be a little bit aggressive. And so I think that you want to minimize your tests. You might want to ask questions, or you might want to minimize intake form and really go at it more on a palpation level. I find that with Chinese medicine, or any kind of modalities that involve touching or palpation, you get the most direct feedback, and you can really get a sense of the patient's tolerance level. The sooner you can understand and know your patient's tolerance level, the better you're at in helping your patient to be within that window of tolerance. Because in that window of tolerance, they tell you everything about what is okay, what is not okay, and that window might be very small. And so oftentimes you need to palpate and feel and touch different areas in their head, scalp, their pulse, their body, to be able to identify where are all the stagnancies. And then you can diagnose. And so when it's chronic, definitely some patients will involve multiple modalities that can help them to rehab, especially if patients have also other mental emotional health. For example, my client, she sees a therapist who does EMDR, CPT, which is cognitive process therapy involving mental emotional, not just cognitive issues, and sensory motor psychotherapy, which is a more somatic based therapy. And so whenever you have a patient who has multiple concussions, definitely patients need a team to support them. And in that team, the different people work on different things. And I think that even though Chinese medicine is quite comprehensive, but in complex cases, definitely you need the support of different things. And so when we're looking at patients who have multiple concussions, definitely a team is beneficial, or support. So for example, if your patient has concussion, you might ask them, their loved ones, to drive them, and not for them to drive themselves. This patient in particular, actually, she's coming from Guelph. So she takes about an hour and a half to come see me. Unfortunately, that's also one of the reasons why she can't see me every day. She managed to come once a week, or 3 or 4 times a month. And she's seen me for 8 sessions. And there has been some changes. She has a lot of different symptoms that she's been exhibiting. One of the most noticeable things. So let me go back a little bit. In her 3 major concussion, the first one was a slip and fall. She hit the occipital part of her head. The second was bouldering. She fell off the boulder and somehow she hit her chin at the bottom. And then in 2021, she was climbing a ladder, or doing a fixture, and then she hit her head on a light. And so since then, she's been increasingly sensitive to any kind of stimuli, even if, like, for example, if she's in the car and her car goes over a bump, she'll notice triggering of nausea or headache. And so when she came in, she had a lot of brain fog, hard to concentrate. She looked very fatigued. She could barely open her eyes. And she also experienced a lot of anxiety and depression. She was socially withdrawn, and definitely her energy was very low. And so she had multiple tension, soreness in different areas. One of the things that she also complained about was this spasm in her diaphragm that she had developed prior to her concussions during COVID, where I would imagine, because I've seen a lot of post-COVID cases where patients have trouble with breathing or diaphragm issues because of whenever they have COVID or cough, they would hold it in. And so oftentimes they wouldn't take deep breaths. And so oftentimes when the patient either coughs too much or hold their breath or not take deep breaths, it creates a stagnation in the diaphragm. And a lot of this also comes from anxiety and fear of being judged that you have COVID. And so then this also creates a new issue in the lung or the diaphragm, and that has to be resolved. And so early on, one of the first treatments that I gave her was to help her to breathe again, to be able to breathe into her diaphragm without the fear of the spasm. Of course, I had to bring a lot of qi and blood into the diaphragm, into the liver to support so that it wouldn't spasm, and also being able to help support her lung so that she would be able to breathe. She had a lot of GI symptoms when we're looking at in a TCM perspective, like low appetite, nausea, gas, bloating, constipation, mucus, and stool. And so a lot of this came from not only the concussion, but also her anxiety. And of course, when you're going through a lot of anxiety and trauma, and you have low energy, your body digestive system shuts down because of the nervous system going into fight and flight mode. or the liver in Chinese medicine starts to invade spleen. And she had also multiple meridian headaches. She basically had all the different types of meridian types of headaches, including Shaoyan headache, which she had like an empty feeling in her head. She hit the top of her head in the drain. She had a lot of pressure in her head in different areas. And also behind her eyes, which is a very common symptom that also happens. And on top of that, fogginess in the brain and hard to concentrate. So basically, she had as many of the symptoms that you can think of with multiple concussion. And so recovery is definitely slow for her. And so for this patient, if the doctors were like, just recover, rest, and take time off, these symptoms aren't going to heal on its own. As a matter of fact, they need to be addressed. They need to be worked on, but they need to be worked on in a definitely in a delicate manner. And when working with patients like this, definitely you have to, I call it peel the onion. You have to work it one layer at a time. You have to really check in with the patient. With every needle, I would say, think of it as a volume control. You need to dial up or down, meaning that when you're needling, the key is the depth and the angle of your needling. Seldom do we think about the depth and angle of the needle, but for patients, this matters. And so it could be the depth of 0.1 millimeter to make the difference between the patient feeling they can't breathe or they feel tense to relax. And so you really want to check in with the patient how they feel with each needle. And one of the techniques that sometimes I use is I needle to a certain depth and then I withdraw up so that the patient gets a little bit of relief, or you check in and if they feel even the slightest discomfort, you just withdraw. This is a very different technique because maybe in school or some of you have learned that like no pain, no gain. You want the patient to feel the needle, but the patient is already feeling a lot. And so it doesn't take much for the patient to feel the needle, especially when they're hypervigilant or they're really sensitive to needle. And so sometimes even a half tune is enough, even just tapping in. And if you do Japanese acupuncture, where you're just like not even inserting the needle, that could be quite effective for some of these patients. And so when you're giving treatments, patience is window of tolerance is the key that I want to emphasize on. We don't have a lot of time. I just want to briefly go over some of my treatment strategy because when we're looking at treatment, I think that treating the Shen is really important, helping the patient to really calm their emotions and working on treating their head. Now, my approach, I use multiple modalities or systems. And so I want to share a little bit about the kind of points that I use in helping the patients with a combination of distal and local points. And so there's definitely a lot of really powerful points that you can use in treating patients. I mean, in TCM, even if you go strictly ashy points in the head, there can be definitely some effect. As long as when you press, if they feel good, you just needle in. And if it's like you stick it in and they're like, I don't feel good, or I feel more dizzy, or I feel more lightheaded. And of course, making sure that the patient has eaten enough or there's sufficient qi in their body and they're not deficient, that they don't get any adverse reaction. The moment they have any kind of adverse reaction, you don't have to remove the needle, just withdraw the needle a little bit, and that can shift a lot. And so there's certain patients that will say, oh, I really love yin tong. It makes me feel really good. So just follow what the patient feels on top of your diagnose or syndrome differentiation. One of the more powerful concussion points that I learned from Japanese acupuncture is spleen 3 and 6. Spleen 3 and 6 definitely brings more blood and qi to the brain. When I think about deficiency kind of concussion patients, I think about, for those of you who study herbal formula, gui pi tang, heart and spleen qi and blood deficiency. And to some degree, this patient does have that too, on top of a lot of different things. But even just starting with a spleen 3, 6, and seeing how much in the brain changes is quite fascinating. In terms of tongue points, definitely a lot of powerful point. I want to mention Zhenjing, Zhenzhong, because they're located around the tendons of the Achilles. The Achilles tendon has been an area that I've been really fascinated in studying, because the Achilles tendon supports the whole body. And the Achilles tendon is one of the areas that I often use to treat lower back pain, very powerful, very effective, or the back of the neck. And so when you think about sacral, cranial, Zhenjin Zhongzhong definitely affects the cranial and sacral. And so by needling close to Zhenjin Zhongzhong, or even kidney 7, kneeling alongside the tendon has profound effect in treating liver and kidney issues and stagnation issues. So I would say definitely go there in some cases. One of the more effective tools is the Tan balancing method. So just to give you a quick overview of how sometimes I would treat with distal needle is identifying where in the head is having the headache or issue. So is it a Taiyang, Yangming, Shaoyang? And I look for distal, Taiyang, Yangming, Shaoyang, wood points, or sometimes even earth points. So what I mean by wood points is the shoestring points, the hands and feet. The shoestring points of hands and feet is in the yang channel is often the wood element. Wood element is connected to liver. Often headaches is due to liver, wind, or stagnation. And so the wood point has profound effect in resolving a lot of the headache. Now, sometimes the headache is not just in the Shaoyang channels, it could be in an area. And so you might have to play with depth and angle to get the right point. So for example, if they have headache in the Shaoyang channel, I might use gallbladder 41 and Sanjiao 3. But if my focus might be a little bit different, like for example, if they have lower back pain and Yangming headache, I might use Lingu instead of Li4. For those of you who study tongue, Lingu is closer to the junction of the thumb and index finger. And so that has a profound effect in treating lower back pain, but also it can help with Yangming problems, especially chronic issues. But if we're looking at, let's say patients have concussion who has heaviness or dampness, then or chronic conditions, I might change to gallbladder 34, which is more of an earth point, or stomach 36. And so whenever you're treating patients in different channels, I would use distal points to target the area. And I would definitely palpate them to see if there's any change distally. And then I would needle more local. And for some of you who are familiar with balancing method, it's a very powerful tool to balance the organs and being able to treat distally. And so in the second kind of treatment that I often use on top of the balancing method is a lot of palpation, checking the pulse, making sure that the pulse is changing, front move points, head, neck, chest, abdomen points, definitely palpating where the stagnations are, and using points to focus on, especially the Ren and Du channel, because oftentimes the Ren and Du channel does get impacted from concussion because of this autonomic nervous system. And so oftentimes to regulate autonomic nervous system, so one of the things that I mentioned before is helping to adjust breathing. And so Ren 17, or palpating the chest wherever you feel tender, to put a needle there, can help to increase the patient's breathing capacity. And the better that the patient can breathe, the better that they can feel the qi move down, and it can help to descend or reduce the not only the physical headache, but the mental emotional anxiety. And so another technique that I often use is needling Attuiment to GB20 using the supine position, which is quite effective. In that area, oftentimes, patient has a lot of congestion, stagnation. Other points, such as the frontal area, premotor, and vertical auditory lines, can be quite effective. For those of you who study from Suzanne Ribidos, she does scalp acupuncture, and some of these frontal area, premotor, or even the additional premotor points, these lines are very effective for treating mental emotional conditions. And so there's also acupoints in the head where I often palpate. And so for my patients, whenever there's a lot of areas of concussion, I would palpate and start needling in some of the points wherever I palpate. And the last modality that I often use is auricular as well to help with their recovery and concussion. But palpation at the end is really crucial because sometimes when we give treatments, we take out the needles and we finish. But at the end, we want to do more testing to make sure that the patient feels good. So you might have the patient sit up. And if they still feel some dizziness or headache, you might want to needle your patient sitting up and try to move or do some balancing tests, standing on one leg, or do some gentle neck turns or looking up, looking down. Because when the patient can look up, look down comfortably or move without dizziness, those are signs that there's more qi and blood circulating to the head. And so definitely for this patient, after 8 treatments, she's had definitely some results. She came in and she said, like, for the first time, she's able to feel a little bit of herself and not need to be so hypervigilant, or she's able to feel less pressure in the head. It might come and go. And so definitely the treatment is gradual, but with patience and time, you can layer by layer help the patient to feel better in their bodies and recover. And so I want to thank all of you because of time. I know that Celine wants to ask me some questions, or you guys have some questions for me to answer. We can go into discussion and see if there's anything else you want me to share.
Thank you so much, Richard. I was wondering, because there's such a gentle approach and you're always checking in with your patient, is there a time that you wait after the concussion happens, or are you treating right away?
I would say that if the patient can, that they would come like either the day of or the next day. The sooner usually the better. But of course, they need lots of rest, right? Because even if they come in for treatment, I think one of the best treatment is just to sleep 24 to 48 hours within the first concussion. And in any situation, when you give yourself adequate sleep, you're giving the brain adequate time to not be stimulated and to maximize the recovery of the brain.
Okay, so 24 to 48 hours. Um, we have someone wondering, are you willing to give up the PowerPoint slides? Can I send those out?
Yes, yes. So I
Okay.
can send it to you and you can forward it to them.
Okay. And is there a name in Qigong for cat cow?
Yeah, I mean, I just call it spinal exercises, and I can show you one or two. That is quite effective. One of the more basic spinal stretches is I would usually have them pull back and breathe in and look up. Of course, like for some patients who have more severe concussion, they might not be able to do that. It could be as simple as breathe in and look down a little bit, breathe in and look up. Or maybe they can't even move even the eyes because
Mm,
oftentimes they can't even look up or down. So
yeah.
they need to start with like breathe in and turn their head and breathe in and turn their head and breathe out. It could be as simple as that. Of course, sitting. Oftentimes, I find patients who are severe concussion when they lie down, it's even worse. because they feel like they have to hold the head. So anything that helps them not to hold the head. But for those of you who want to maintain your spine, it could be like breathe in, pull back, and look up, and breathe out. Just push and look down and curl your spine. And so when you're standing up, you're breathing in and pulling back, and then breathe out and you're bending your knee and push. So this is a modified cat cow where you can do it seated, um, or you can like uh, breathe in, bring your palms up and push up, and then breathe out. Just lean forward all the way down and go into a waterfall, and then
Mm,
breathe in and slowly come up spine to spine, and then come up again and breathe out, push up, and then go and do another waterfall. So these are just very simple spinal exercises that you can do. Another really good one is helping the patient to turn their bodies. So they could be like breathe in and breathe out and turn left, or even all the way to the back and breathe in and out, just left and right, turning. Um, those movements, anything with turning is really good for Shaoyang problems, issues with dizziness, vertigo. And so anything that helps the patient to start to turn a little bit will help them. In the gradual recovery, definitely light exercises and as a definitely not like jumping or intensive exercise or heavy lifting or light stimulation. Those are often much more strenuous for the brain.
hmm hmm Yeah, very gentle. It's that going with the breath and that slow following that the slow movement.
Yeah,
Um,
it's strange because the slower you do it, the faster the recovery. The faster you do it, the slower the recovery.
because of that overstimulation, you mean?
Yes.
Um, are you typically it's been said to not sleep within the 24 hours um, of concussion.
I don't know why it would be suggested to not sleep, and maybe patients are afraid or doctors are afraid that they would, I don't know, become unconscious or something, or they want to engage the brain. But I would say that like if you're tired, don't force yourself not to sleep because your body is telling you I need to turn off, but you don't have to sleep right away. Just check in with the body and feel into the fatigue because some of us don't even feel tired because we don't let ourselves to feel tired. And so a lot of patients will find that after an acupuncture session, they feel tired is because that's actually where their energy is at. But most of the time they're over functioning
Mm,
or high functioning and they're not letting themselves feel tired. So concussion will force them to actually connect to their true energy and actually respect their bodies and let themselves to rest.
I think the from the doctor's recommendation about the not sleeping is they're afraid of the brain swelling, and so if you're sleeping, people don't know if you've actually passed out or not.
Right.
I think was the danger with that. Do you use electroacupuncture in your treatment?
I don't use a lot of electrical acupuncture. Um, Definitely, electrical acupuncture has some benefits and uses. One of the reasons why is because I have less control with electrical acupuncture, and sometimes electrical acupuncture is another stimulant. And so, if patient is just pain strictly, it's different. But if there's any kind of mental emotional condition and you add electrical acupuncture, sometimes patient might it might not allow them to relax or to calm down. And so ultimately, if a patient sleeps and if electrical acupuncture, they're okay with it, it's great. But I would say it has its pros and cons, and it really depends. And if you get to the right point, the patients will already feel it. You don't need to add more stimulation sometimes.
Right. Um, So someone was asking, does the medication that this particular person factor into your acupuncture treatment, or does it work around the side? Does acupuncture work around the side effects?
Yeah, we often take into account to the side effects of the medications. And so we're also working with reducing some of the side effects. That's our way of working with the medications. Um, so I would say that we're not going against the medication. We're just working alongside the body in response to the medication.
Okay. So how do you determine if it's the medication or the concussion?
It's hard to tell, but I would say that we are, whether it be the medication or concussion, we're reducing some of the symptoms that is creating discomfort.
Okay.
We are focusing on helping the patient to feel more well overall.
Right, 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 right. Okay. And is your treatment plan similar if someone is into the chronic stage of their recovery?
Yeah, I think in the more chronic stages, we're just looking more at multiple symptoms. Sometimes it's hard. You're just managing symptoms and reducing the symptoms layer by layer. But I would say don't forget the internal organ piece because chronic conditions are often due to also organ imbalances. And that's where the power of Chinese medicine comes in because we're not just treating the head or the pain, we're treating the organ which supplies the blood, the qi, and the nourishment that the brain needs to improve.
Mm,
For example, the lungs.
okay. Um, Going back to the eSIM, so they find concussion patients tolerate eSIM in the head much better than the body for some reason. And they're just wondering if you might know what that's about.
Yeah, like for some patients who have concussion, and I noticed that like it's not necessarily liver young rising. They might have like qi and blood deficiency, and usually the neck and shoulder creates a lot of tension, and it cuts off blood flow, and it doesn't go to the brain. So you can think of it as the brain is lacking nourishment, and sometimes one of the things I forgot to mention is nose breathing. Nose breathing ensures that there's quality oxygen going through the brain. If you breathe through the mouth, it doesn't go into the brain, it just goes into the stomach. And so, one of the things that you want the patient to have is more oxygen and blood to the brain. And so, you know that whenever you do local, if it's a deficiency, the patient will feel really good because they need more brain stimulation, more qi and blood to go to the brain. But
Mm,
when they are anxious or they exhaust their chi and blood, there's no blood to the brain, then they'll feel like the brain is tired or exhausted or foggy. And that's why brain exercises or massages are also
mm,
really good to help stimulate the brain. So those are deficient patients.
right. Yeah. Can you say a bit more about helping lung qi? And can you talk a bit about like what they could tell a patient to do on their own? So you
Yeah.
mentioned the breathing.
Yeah. So lung qi, one of the areas that I often palpate is lung one to make sure that that's not tender, or palpate the lung along the kidney, stomach, spleen line, because when there's tenderness, that means that there's some external muscle intercostal channel stagnation, and that's actually preventing them from breathing fully. And so on the acupuncture needle side, you can needle locally to resolve it. In terms of lung, I would say um, even just giving them different types of breathing exercises. They can do box breathing. They can do even an exercise that focuses for them to breathe in, breathe out. It could be as simple as like bring your arms up, breathe in, and then bring your arms down, breathe out. Push forward, breathe in, and pull back, breathe out. Um, just any kind of open, close, up, down, just helping their body to move. You don't even need to know Qigong to be able to tell patients to just breathe in with one movement and breathe out one movement. Or just go on YouTube and you'll find very basic breathing, moving exercises. Uh, Qigong is just matching a movement with a breath, and to be able to inhale, exhale. Of course, there's a much deeper practice, but for patients who are just recovering or learning, um, you're just helping them to connect to their bodies in a way that they're not used to.
It seems so simple, the idea of reminding people to breathe, that nasal breathing that you're talking about. I think a lot of us, we get stressed and either we stop breathing or we start panting like through the mouth, right? And it really is that nasal breathing that you're talking about to remind ourselves to do that. Um, you've listed a number of acupuncture points. Do you give yourself a limit on the number of needles you'll do at the beginning?
Yeah, I mean, I often minimize the number of needles. Like it could be like distal could be like 4 to 8 points, right? And then local, a few points, just depending on, because if the distal can't deal with or clear out most of the pain, I might do some local. And so usually the distal points should eliminate the local problem at least 50%. And
In the
so
beginning, you're talking about this
in
is
the
like acute.
beginning, yeah, with the acute phase and even chronic phases, you're looking for targets or areas that you want to eliminate or work on, and it could be one thing or different things, the front or back. I would say that it really depends on your patient's tolerance level.
Right. Okay. So checking in with your patient.
Yeah, because like the less, the better. Like try not to push it, and you can feel when the patient is at their limit sometimes when they're tensing up or when they're really giving a bigger response.
Right. Right. Do you have master points?
Um,
And which would they be? Or are they different depending on
you mean like points that are like really effective?
um I don't know, maybe. Master
Well,
points.
I remember using like 2 needles to help a concussion patient to recover fully in one session, and they were the auditory vertigo points, or gallbladder 8 and 9, and so these 2 points are quite effective in releasing any kind of pressure in the head. I would say that think of it as like a person wearing a helmet whenever they have a concussion, they automatically develop a invisible helmet to protect their head after the concussion. So you might have to help release some of that pressure by doing these 2 points. And they're like screwing on, it's like if you have ever wore a bike helmet, it's like screwing it tight or loosening it. These 2 points are very effective in doing that. Of course, if you combine with do 20, very powerful in creating a triangle in the head. And so often I use geometric shapes to also create a stronger dynamic or a stronger synergy between points. And
I
so
see.
when you're working on points, when you create a triangle here or creating a square in different areas, if you do like yin tong and then do 16 and then these two, like it can be very powerful in releasing any kind of stagnation all around the head.
Thank you. Are there any other questions that anyone has? Again, we'll get the PowerPoint slides from Richard and I'll email those out with the recording for this. Um, again, sometimes it's really going back to those basics and really being very simple and conscientious and communicative with your patient. Um, are there any contraindications to be aware of?
Yeah, I mean, I already mentioned a few, which is being aware of patients' window of tolerance. When you go beyond their tolerance or um, they hold even something as simple as you have your music in the background, right? And then by the end of the treatment, the patient feels more headache because they were actually not willing to ask for what they need, or they're not aware that actually music also creates a little distraction in their head, or noise. I think they're just very simple things that often we don't pay attention. Or if they're cold and you don't cover them or put a heat lamp, and then they all of a sudden feel like worse because cold causes tension in their body, or they don't feel relaxed, or they're holding a position like you're doing PC6 and they're holding an arm and they're tense. Even little things like that can actually cause them to feel tenser. And also, I would say that I'm less prone to doing face down treatments because they tend to have more dizziness when they get up, or the blood pools in a certain area. And so initially, I would do them face up or seated, to test their mobility. And then over time, when they feel comfortable, I might do them limited time face down, or have them side treatment, or needle it just in and out at the end to clear any
Mm.
kind of problems. Don't retain the needle.
So it's a great way to really look at things, being very gentle and to consider all of those points. Like it might not just be the treatment, it might be, as you're saying, the cold or the sound or the light or the yeah.
Yeah, because they are sensitive to everything. Think of yourself as like super vulnerable after being like invaded,
Mm-hmm.
right? It's like everything, like if you ever had someone break into your house, and then you go home, you don't feel safe at all. You're hypervigilant, you're looking out for everything, you don't feel comfortable in your body. And so when you go into a new environment and someone's about to stick in needles, they might create another trauma. It's like, if I don't feel safe with this person, I'm going to stay guarded and I'm not open. I'm not
Right.
relaxed. And it's going to create another trauma.
Yeah. These are such great tips. Someone was wanting to confirm, what about the do 20 and SI3 bladder 62 to create rectangular grid?
Yeah, like I forgot to mention, but like Do20 is really powerful for treating PTSD. And the four alarming points at the top, just bringing more energy to the top. In a way, you're protecting the patient from leaving or dissociating. Do20 definitely brings their Shen back into their body, and then the SI3 bladder 62 can bring them more into their spine, back into their bodies. And so those are great combination. Sometimes I use more of 65 or 60. 65 is the wind point. It works more on the musculoskeletal aspect, where bladder 62 is more at a deeper psycho-emotional or generational treatment. And so, or ancestral treatment. So you want to maybe use points like bladder 65 for more like occipital headaches.
I see. Okay. Great. Well, thank you, everyone. And thank you, Richard, so much for joining us tonight and all of your information and great reminders.
Thank you. Thank you, everyone.
And we'll be in touch soon. Thank you. Bye.
Great. Take care.